everyone. Thank you for joining us today for this session on submitting retiree benefits plan claims online through MyARTa. We are excited to tour you through this fantastic new online platform that provides real-time self-service options for you. My name is Amanda Shaw, and I'm the Chief Marketing Officer for ARTA. I'm joined today by Gary Sawatsky, who is our Chief Operating Officer, as well as by Suzanne Mafosa, our Member Services Team Lead, and Jennifer Hope, our Affiliate Marketing Advisor, as well as Christine Willis, our Senior Executive Administrative Assistant. I might have added one too many words there. We've pulled some of our best and brightest together today to be available to answer any questions you may have throughout the webinar. As you may have realized, we have disabled attendee video and audio capability. This will help ensure a quality experience for all of our participants by limiting web streaming. It also allows us to record this webinar for future use without breaching your privacy. With your audio muted, we encourage you to submit any questions that you may have using the Q&A feature found at the bottom of your screen. It's a little button that says Q&A with 2 speech bubbles. By pressing that, it will open an option for you to type in your questions. You can submit questions either publicly so that all attendees can see them, or submit them privately so that only our ARTA staff will be able to see them. If you are submitting personal information, we do suggest you use the private submission feature. Our team will respond to questions throughout the webinar. If your question is personal in nature, we will type you a response. And if your question would benefit the entire group, we will address those questions live. We also have created 2 polls with questions that you can answer today. Participation is optional and anonymous, and will simply provide us with some information that we can use as we continue to develop the ARTA Retiree Benefits Plan and the tools we use to support it. We're going to open the first poll now. And with those housekeeping matters completed, I'm going to welcome Gary Sawatsky to open our webinar with an introduction.
Good morning, everyone. Thank you, Amanda. Thank you all for joining us this morning. As you are well aware, we have lots of exciting changes happening at ARTA. With those changes, we're basically changing everything at once. We have a new benefit claim adjudicator. We have self-administration, which is a huge step forward for us and something which is really going to benefit the members in the long run. With that, we have a lot of questions that we are receiving from our members. We thank you for your patience. We did anticipate a huge influx of calls to our member services team, and that has come through. We are getting a lot of really good questions and a lot of really good emails. We know that the first couple of weeks is going to be very busy. So again, we thank you for your patience. We have a lot of new technologies to work through. A lot of the time we're spending is working through those technologies with our members. And hopefully we'll be able to answer some of the questions that you may have had today going through our new system. So with that, I'll turn it back over to Amanda.
Great, thank you. So I'm just going to share my screen here quickly so that we can walk through all of the examples together. Let's jump right in. All of our active members of the ARTA Retiree Benefits Plan have access to MyARTA. Your account has been created for you, but if it is your first time logging onto the new MyARTA website, you do need to register an account. It looks like on the polls that most of you have successfully registered your account, so we're grateful to see that. We're going to use our test account here to log in. If you haven't already registered your account, you can find web tutorials on how to register for MyARTA, both on arta.net as well as on the ARTA YouTube channel. We will send out links to both of those in an email following this webinar. Once we have logged in, you can find the claim submission area in the blue menu bar. MyARTa Claims is where you can submit claims, check eligible coverage, and so much more. That's the section that we're going to focus on today in this webinar. Click the Access ARTA Claims portal button to proceed. It does redirect you to a claims portal, and this can take a few seconds. Once you're on the ARTA Claims portal, there are 2 different areas where you can submit a claim from. You can submit a claim directly from the Quick Access section on this homepage, or by going My Claims, Submit a Claim. Today, we're going to walk through 3 different examples for submitting a claim: a drug claim, dental claim, and extended health claim. After each claim that we walk through, we will stop and answer any questions that may have come in specific to that type of claim. When we submit a drug claim, we click Submit a Claim, and then we select drug from a list of items that you can claim. This will open an online form. You'll need to specify the plan member who you are claiming the drug for, whether it is yourself or one of your dependents. The primary plan number always starts with 00. The spouse would be 01, and then any child dependents would be 02, and 03, 04, and so on. This opens the online submission form that you can just fill out for your drug submission. It does ask you if you have coverage under another benefits plan. This is specific to private benefits plans. So if you have coverage under a government plan, you do not need to specify this here. It is strictly for if you have coverage under a second private plan, whether that be a Sun Life or a Manulife that perhaps your spouse has. So in our case, and for most members, they would say no, they do not have coverage under another private benefits plan. For every claim, it does ask if it was incurred as a result of an accident. And then you simply attach any receipts or documentation associated with your claim using the document upload feature. We did have lots of questions yesterday in regards to how do you submit documentation if you don't have a scanner. Your provider could send you an email with your receipt. You could take a photo of your receipt using a smartphone or iPad and upload it to your computer through email, or you can use the online app to also submit directly through your phone that way. So those are a couple of options if you don't have a scanner. So I'm just going to attach a document here. There is an additional information section. This is an optional field where if there is something that you feel would be necessary for further explanation of your details, you can enter it here. You then click submit at the bottom. Once everything is filled in and attached and you've clicked submit, you will see a claim submission confirmation screen. This is how you know the claim has been successfully completed. All drug claims are reviewed manually by our third-party adjudicator, Green Shield Canada. Because of this, it could take several days to process a drug claim, depending on the volume of other claims at the time. If you're curious about the status of your claim, you can go to My Claim, My Web Uploads, and you'll be able to see the drugs that the claims that you have submitted. We did a couple of tests yesterday, and as you can see, that one is in progress, which means that claim is currently being reviewed and adjudicated, and the other claims have been received and have yet to be adjudicated. Once a claim has been successfully completed, it will be removed from this list, and you'll be able to find it under My Claims and either My Claim Statements or search My Claims History. That is the drug submission tool. So I will take a minute to check to see if we have any questions related to drug submissions. It looks like we don't have any, but I'll give a minute in case anyone would like to submit one. Excellent. So next, let's take a look at submitting a dental claim. To submit a dental claim, once again, we start by clicking My Claims, Submit a Claim, and then we click Dental. Now there are several options under dental. Dental estimate for services allows you to check your eligible coverage before receiving a dental procedure. So if you have an option that you've gotten an estimate from a dentist for work, you can check to see your coverage level before receiving that treatment. Otherwise, if we're submitting after the treatment has already been completed, we select dental services. Again, so we do have to say that we are submitting this claim as a primary benefit plan, and then we click next. Now, if you have submitted a claim with a provider before, they will show up under a list at the top where all you have to do is click your dentist's name to proceed. This will show up to 5 service providers specific to dental provider when submitting a dental claim. If you are looking for a different dentist or you haven't submitted a claim before, you can click search for a new dental provider. This will open an option to search by either phone number or by last name and first initial. You do not have to enter both fields. You can simply enter one. If your dental provider has a very common last name, you might receive multiple results, which is why then it sometimes is easier to search by their phone number if you have that information. So when you've searched, it pulls up a complete list of all of the providers registered in their system. So we can select our dentist, which then opens the claim submission form. Again, you do have to indicate who the claim is for, and if you have coverage under another private benefits plan. Again, you have to answer if it is incurred as the result of an accident. And then you need to complete the form provided below. So we'll just enter a couple of test situations here. You can see the asterisks next to some of the fields. Those are the mandatory fields, as opposed to the fields that do not have asterisks. Those are not mandatory and will just be needed to filled out if it matches the statement that you've been given by your dentist. Once you've entered your information, again, you click submit at the bottom, and you will be taken to a confirmation page for dental. So this allows you to review what you've submitted before submitting. It also gives you the opportunity to change your information if you have entered something incorrectly. So we can submit. And we receive a summary of our successful claim submission. There is an option to print what you have submitted. You can see the printer button in the top left-hand or top right-hand corner here. And then it also gives you an explanation of what you've submitted. So here we can see that we claimed $37 for a recall exam, that the amount that I need to pay as the plan member is $7.40, and that the amount the plan has paid has been $29.60. It shows that I'm awaiting payment. It also shows that the second claim that I have submitted was denied, and it gives me a reason as to why my claim was denied, and says that I need to resubmit with the correct fees and corresponding lab charges. So it does give you that explanation for each item on your claim and what the claim status is. Let's just have a quick look. I see that there are some questions coming in. I don't see any questions, so. Yes, so there's a question, will providers still be able to submit claims on our behalf if they have the capability? Absolutely, that still applies. So if your provider does direct billing, they will still be able to submit their claims on your behalf. This is simply if you would prefer to submit your claim yourself, or if you went to the dentist and didn't take your benefits card with you and now need to go back and submit it after the fact. So if you have providers that direct bill, then you are able to go and do so. So again, we've submitted this claim. When we go to MyARTa Claims home, it does show a summary of all of the claims that we have submitted at the bottom of the page. So view all claims. It shows our recent claims. It shows that we just submitted our drug claim as well as a recall and crown-on implant. It shows the status of those claims. And it shows other claims that we have and whether they've been paid or if they're in progress or received. So this is a great dashboard, which can be found in the MyARTa Claims home section. Again, you can also search your claims history or find your claim statements for any paid claims that have been submitted. So here we can see your claim statement for January 8th. It does open in a separate pop-up box. And so I don't think you can see that, but it does give a list of everything that you have submitted. So that is there for you. Yes, so if a provider submits a claim, it will show up on here as well for you. So we will look at an extended health claim as well. We're going to use massage therapy as an example. It's a good general one that lots of members get, and I know we could probably all use one right now. So let's submit a claim. And so you find them under professional services along with chiropractor, occupational therapy, podiatry, and so many more. So these are all here for you. Again, you can search for a new massage therapist if you need, or there are a list of providers available. If you've gone to the same provider before, then you can just click their name. Again, it opens an online claim form that you need to complete in full. So we select the plan member. And as you can see, your provider information has been filled in already based on your previous submission. Again, it asks if you have coverage under another private benefits plan. So in this case, we can say no. It asks if your treatment was required due to a motor vehicle accident, as well as if it's due to a work-related injury. And then it does ask if you have a medical prescription to submit with this claim. So if you do, you just select yes, and then you need to enter the date of the prescription as well as the type of medical professional that gave you that prescription, whether it was your registered nurse or a nurse practitioner, or if it was your physician. So all of those doctors are available in here for you to select from. And then it does ask if GST or HST was included in the total amount of the visit. You can enter up to 5 treatments on one claim, provided that all 5 treatments were with the same massage therapist or service provider. So if you go for several treatments and then save your receipts for submission later, this is a way that you can do it a little more quickly. Again, you just put in the date of your treatment. And then the total amount of your visit. And then you can submit at the bottom. Again, it will give you a claim submission confirmation screen so that you can confirm the details before you submit, and then you can click submit. So once again, it shows us our claim submission results. There is an option to print, again, at the top right-hand corner. It does show that we're required to pay the $18 and that the plan, our retiree benefits plan, will pay $72 and that our claim status is awaiting payment. As it explains, payments for claims with the status of awaiting payment will be processed on the very next business day. So you will receive your claim the very next business day through this system. It also gives you a summary of your plan limitation. So it does let you know how much you've used to date of your limits, including this most recent claim that we've submitted. For all of your claims, you don't need to send in any of your original documents. So as you can see, when we submitted this claim, it did not ask us for a receipt. While you don't need to send in any of your original documents, we do recommend that you keep them on file for 13 months in case your claim is randomly selected for an audit. If your claim is randomly selected for an audit, you will receive notification quite quickly after submitting your claim, so you don't have to worry about digging out receipts months and months later, but we do recommend keeping them for the full 13 months. If you are selected for an audit, you will receive an email notification with instructions on how to submit the original paperwork. You can do that through this online system or by mailing them physically into the address that will be provided in that audit email. Again, you can view your status of your submitted claims by navigating back to the menu on the left-hand side, going to My Claims, followed by My Web Uploads. Now, claims that automatically go to awaiting payment will not appear in this My Web Uploads screen because they've already been processed. They will go directly to the My Claim statements, but you can also find them on the homepage again in this recent claim section, where you can see whether it's awaiting payment or if it's been paid or denied. To conclude this tour, we are going to look at a couple other features that might be helpful for you. Find a Help Provider is a tool that allows you to search for a help provider. We say it's especially helpful if you're traveling throughout Canada and maybe need an emergency treatment somewhere in a town you're not familiar with. You are able to search for a different city or town, or even more specifically with a postal code, and by provider type. So if we needed to get an emergency dental appointment, we can search in Calgary and find a list of dentists that are in the ARTA system. So this just allows you to maybe find a help provider if you need one while traveling, or if you're looking for a new help provider in your area that you're unfamiliar with them, you can use this same search feature to find those. You can select your favorites as well if you find someone that you really enjoy. You can also check your coverage before receiving a treatment. So you can go here on the homepage again, or under My Benefits, view My Benefits coverage. You can check your coverage before you receive a treatment to see what you have remaining, or just to check to see if it's covered by the benefits plan. We'll do 2 examples. So again, we can check our massage coverage. Say Jane wants to go for another massage. She's had 6 this week, but that wasn't enough. So she can put in that she'd like to go for one today too. She can put in the amount and the province in which she'll receive this treatment, and then we can submit. It lets her know before Jane goes and gets her treatment that she'll be required to pay $18 and the plan would pay the $72. And it does let her know that she's used $216 to date. So if you remember from the last claim we submitted, it had included the amount of that claim. Because she hasn't actually received this treatment, it's just showing her amount used to date, not including if she goes for a massage today. So that information is here should you need it. We can also, for example, search for a drug and see if that drug is covered by the ARTA Benefits Plan. Now, when you search for a drug, it won't tell you how much you have remaining on your prescriptions on the ARTA plan. It just tells you if that drug is covered. So if we search for prescription drug, and I should have the name of one, but if not, Gary, you might have to tell me what it is.
You can try atorvastatin, A-T-O-R-V-A.
I'll put in the V. So if we search for Atorv, not knowing how to spell the rest of that drug, you can do so, and it will return search results for you to filter from. It may just take a minute. You can also search by drug identification number if you have that information handy. So as you can see, it's telling us to confirm our drug, and there it is. We'll say we're looking for the 20 milligram tablet, and we'll confirm. And here it lets you know that yes, you are covered under the Alberta Retired Teachers Association Retiree Benefits Plan. It is subject to the applicable copay, deductible, and/or maximum on your plan, and that the copay is 20%. So this is a great tool that you can use to check whether or not a medication is covered by the benefits plan before going to the pharmacy and having your prescription filled. So there is another question in regards to if you have no scanner and no photo ability. Again, if your health provider can direct bill your claim, that's an option. Otherwise, if they can email you a receipt, I know lots of health providers have that as an option now. They can email you that receipt and then you can simply attach it. But as you saw as well, you really only needed to submit receipts with drug claims. So those would be the ones that you would need to have copies of your receipts online. Luckily, with most pharmacists, they do direct bill, and so that might be a solution there. So that does, if you can't find the answers you're looking for, you can also check on the support center. So the support center is a feature of the MyARTa Claims page that is loaded with answers to frequently asked questions to help you make the most of your ARTA experience, including how to submit a claim or specific questions related to travel claims or frequently asked questions that are a little more general. It also includes a link to the tutorial videos that we have on our ARTA YouTube page. If you can't find the answers you're looking for in one of these sections, you can also contact us for further assistance or additional information by calling the ARTA office Monday to Friday between 8:30 a.m. and 4:00 p.m. Mountain Time. Our phone number is 1-885-444-2782. You can also send us an email to info@arta.net. All of that contact information can be found on our website, arta.net, or in MyARTa. With a new year, new web tools, and new member ID cards, we have been experiencing higher than typical call volume and email volume, and it may be difficult to speak with a member of our team instantly, but we are working hard to respond to all of our members. We do thank you for your patience and your continued support. We're very much looking forward to serving you even more closely in the year ahead. That does conclude our webinar, but we do see more questions coming in, so we're happy to answer some of those for you. There is a question about how claims are paid out. They are paid out via direct deposit to the account that you have on file with ARTA for direct deposit. These would be the same accounts that you used with ASBP. If you have it selected that you prefer checks to be mailed out, I think there's 8 whole members in ARTA that have that feature. They will receive their checks, but everyone else will receive direct deposit into their claims. What was this? There's a question about the green panel. So I'll just do a quick, if this is the green panel here, MyARTa Claims home takes you back to that main landing page where you have quick access to submit a claim, quick access to check coverage, and a summary of your recent claims. Find a health provider is the page that opens up the map where you can search for health providers. It always just takes a second to load because of the map feature, but that's there for you there. My Benefits, view my benefits coverage, allows you to check your coverage again, just like on the MyARTa Claims homepage. My Claims, submit a claim, allows you to submit your claims. Personalized claim forms. This is if you wanted to take a physical form in and have it filled out with your service provider. There's several options here, your general claim submission form or your dental form. So if your dentist, for example, does not offer direct billing, you could come on here in advance of your appointment, select dental form and your name, and you can open the form and it will pre-populate your personal contact information into the form. And then you can just fill out the rest with your dentist in person. My claim statements and search my claim history is a history of your claims submitted on or after January 1st, 2021. 2020 claims statements will be available at the end of February, the ones that are created for tax purposes, your premiums and claim statements. Those will be uploaded into your MyARTa account, again, by the end of February. You will receive a notification when they have been uploaded there. My web uploads, again, this is a summary of claims that don't receive immediate adjudication and that do go for manual adjudication. They will appear in this section here. And then plan member summary is just a very quick overview of your coverage. So it's just a very high level. And then the support center, which takes you to the separate web page where there's frequently asked questions and the answers that correspond with them. There's a question about, is there a way to access this webinar at a later date to review? Yes, we will be posting the webinars on our YouTube page. We'll take the best of each session and post them there. And so they'll be there. We will send links out to those in the artifacts that will get sent out in mid-January, but you'll also be able to find them on that YouTube page. Will the claim process keep your data if you stop partway through the completion of a claim? No, it will not. So if you start submitting a claim and do not complete it, there is no way to save it, I don't think, and you would have to restart it. So we really suggest having everything put together before you start a claim, as there is no way to kind of save a claim once it's in progress, as you can see here. If there are any more questions, we're happy to answer them now. Otherwise, Christine has posted the second poll here. We would also answer again any questions that are typed into the Q&A box now. Otherwise, an email will be sent out to you following this that will include links to an article on our website that walks you through how to register for MyARTa, as well as the links to our YouTube page where all of the tutorial videos live. There are separate tutorial videos for submitting a drug claim, dental claim, and extended health claim. So do look for the one that's specific to your needs. This webinar and the other webinar topics will also be posted to YouTube in the next week so that you can reference them as you familiarize yourself with MyARTa. We thank you so much. Oh, there's a question on whether your session will be timed out. This website's time out, I believe it's after 30 minutes of inactivity. So if you walk away from your computer and then return after 30 minutes, it will have timed you out. That's a security feature that's common with any websites that have personal information. So that is a feature of this. So you do have 30 minutes. It won't time out on you instantly. You'll have time to go get a receipt or make a phone call if you need to, but 30 minutes is when it will time out. A great question on where you can find all the questions asked today. We have been copying and pasting them for our own records, and we can certainly go through those and compile them into a frequently asked questions. We can add those as an announcement on MyARTa so that they're in MyARTa for you to review should you need the answers to those. We thank you so much for your participation. If you don't have any further questions and you've had a chance to answer the optional poll, you may leave the webinar at any time by clicking the leave button at the bottom right-hand corner. We will remain available if you in case there are any more questions that do come in while individuals are leaving. So thank you so much. There's a question about travel insurance. So travel insurance is run through Allianz, not through this portal. So to access that information, you go to myarta.net, and then there's a section called Benefits and Claims Forms. There is a travel section there that includes the hard copy forms that you need for travel claims, as well as a link to the online travel portal for submitting travel claims. To those of you asking for assistance, whether it is through MyARTa with incorrect information, so you're not able to validate your account, or those of you who are have the incorrect information, we have your first and last names. Thank you very much. Jennifer and I will get in touch with you immediately following this webinar. We'll give you a phone call to walk you through the process. Suzanne, there's a question about coordinated benefits. Do you want to answer that one? Oh, you're on mute.
So once you have provided coordination of benefits information, it will be kept on. It will be kept on file.
For the question about a service that was received in 2020, any 2020 claims can also be submitted through this service. So any claims from January 1st, 2020 up till today can all be submitted through this new online claims portal. So if you didn't get them in before the end of December, that is okay. You can now use this new system to submit those claims. Where do you find the claim for CPAP supplies? So let me just open this back up here. So I'll just reshare my screen. So we are right now in My Claims, Submitted Claims, and you can see here under breathing, respiratory equipment and supplies, there's CPAP, APAP, and BiPAP machines, masks, and supplies. So there's 3 different categories there that you could submit the appropriate claim under, as well as a couple of different breathing and respiratory equipments as well. So that is where the CPAP machines live. Excellent. Okay, thank you so much, everyone, for all your questions. Carrie's answering that one. The tab for tension stockings. So that is a good question. Oh, footwear, maybe? Zanny, do you know? Oh, there we go. So tension stockings are living under garments and braces. So you can see them here under compression stockings. Apologies that I went a little fast. It is my nature to speak quickly, or in my family, you don't speak at all. I will try and be slower in future webinars. There's a question about a provider not being able to bill. Providers can direct bill. Green Shield Canada has a fantastic system for doing so. I'll let Gary elaborate on that as well.
Thank you. If your chiropractor is not set up to direct bill with Green Shield, you can have them visit providerconnect.ca. That is the provider website used by Green Shield and a number of other providers to get set up on the Green Shield claims system. They have a lot of great support where they can contact the chiropractor, assist them in getting set up on the system, and then hopefully your chiropractor will be able to direct bill directly to Green Shield.
All right, again, thank you for attending. If you have no further questions, feel free to use that leave feature in the bottom right-hand corner. We appreciate you taking the time today to join us. And we're glad to hear that you're excited to use the new system to save some time. We're excited for you to have instant claims submission as well. So we hope you enjoy the experience.
Hi, yes, all of the providers that could direct bill before still have the capability as long as they are on the Green Shield system. With regard to pharmacies, virtually every single pharmacy in Canada is set up to direct bill with Green Shield. If they are not set up, they can contact Green Shield on their providerconnect.ca website. That's providerconnect.ca. But I would be very surprised if they are not already set up on that system. And all that we are doing is providing additional capabilities for members to be able to submit electronically. All of the previous submission capabilities are still there. People can still submit paper claims if they want. People can have their provider submit on their behalf. All of that is still available.
Okay, this concludes our webinar. Thank you so much for joining us today.